Hello everybody, this is Dr. Bob DeMaria with another episode of Ask Dr. Bob. Tremendous questions once again. Dr. Bob, you said fruit is not good. I've never said that. I have said that it would be wise not to eat fruit because it causes blood sugar distress and pain. If you want to eat fruit and have pain, more power to you. And I know that you were concerned because you wanted to have fruit and you said it was good for the brain. You know, what I have found one of the best ways to help support brain function is having really good oil inside of your body. You may consider the optimal or the EFA blood spot test to check out your omega-3 fat. See, what I have seen in our practice, and you have to understand, we kind of do research in our practice. People have fatty livers who eat a lot of fruit, so I would just avoid it and just think about considering some oil. How much iodine should I take as a supplement? Well, ideally perfect, the best thing to do would be to do a urine iodine loading test. And I take 12 milligrams of iodine every day. You could also do a TSH, a T3, and a T4. That's a thyroid test. Look at your T4. If it's less than the midline, you probably need iodine. But specifically, the urine iodine loading test will be very important for you to get exactly what you need. Dr. Bob, I get a massive migraine before my menses. This is what I've learned about menstrual headaches. It's usually too much estrogen. And estrogen has to clear your body through your liver, and you have to minimize the amount of estrogen exposure, whether it be through water, through food, from conventional meat, walking on grass that's been sprayed. You may consider something called calcium deglucarate. Calcium deglucarate gets rid of those unwanted estrogen toxins from your body. There was an individual that watched me on my Facebook Live, and she wanted to know how does she determine, or how do I determine vitamin B, C, D, and E, etc. Well, the way that you determine that is you need to do some kind of testing. And I'm going to tell you, probably the most cost-effective way is an organics urine test. We really drill down to find out carbohydrate metabolism, fat metabolism, protein metabolism. So for a couple $100, you can learn so much about your body. I'd rather have you spend a few $100s on determining what you need rather than $50,000 or $100,000 on surgery. We had one lady recently in our practice spend over $200,000 on breast surgery alone. So that's something to consider. And going back to the woman who had the severe headache with her menses, that's too much estrogen, and estrogen excess is a common cause for breast cancer. Is there an answer for cellulitis? And you mentioned under your arms. Well, one of the things that I have learned is a lymph congestion. You know, we do thermography, breast thermography in our practice. And I'm not sure where you live in the world, but you may consider contacting us and spending a few days when we all be doing it again in 2017. But your arms and your armpits are a part of the lymph, and it drains into your liver. So one thought would be you may have compromised liver, you may have compromised lymph glands. If that's the case, we use something called larch gum to get that lymphatic system going. Bounce on a ball 10 or 15 minutes every day and rule out parasites. You know, cellulitis could be caused by a lot of different reasons. I'm just ballparking that for you right now. Dr. Bob, I have arthritis in my shoulder, and my doctor recommends Tylenol for arthritis. Well, I can tell you one thing about Tylenol without being silly. Sure way to get kidney challenges, because Tylenol will aggravate the kidneys and aspirin aggravates the liver. So I'm assuming this was a female, because you mentioned your name. What I have seen is that most females don't have arthritis in their shoulder. They usually have tendonitis and bursitis, unless it's been, of course, diagnosed from a film. So we encourage apple cider vinegar. It's all about pH. I'll be releasing my new book, which I'll show you about in a minute. We have a chapter just for you on tendon inflammation. I'm really excited about the new book, by the way. This last question is, how could you tell me which causes aching eyes, which sometimes go into a headache? I don't drink, I don't smoke, went to an ophthalmologist, talked about eye health, and throw up and get queasy. So I don't want to go to eye specialists again. Now, I have noticed queasiness over here, over your head, and throwing up could be a liver gallbladder issue. Queasy stomach could be your gallbladder. I know it sounds kind of interesting for me to say that, but we see that a lot Obviously, it could be a lot of different reasons. Okay, so thanks for all those questions. I'll be releasing Dr. Bob's Guide to Prevent Surgery. So the young lady that was asking me about tendon issues, apple cider vinegar has a lot to do with pH. We also have information in here, the chapter for those of you who are questioning about the fibroid. We have a chapter in here about, not the fibroid, but about your heavy menses. We address that in this book, you know. I have in my hand right now several labels that you'll see on furniture that says do not remove, and I really love this. I think that all of us should be born with this label on our head that when we're born, do not remove, because I have learned the only successful surgery obviously is one that's never needed to occur. So this will be out, be a great holiday gift, it'll be a great gift for anybody. Dr. Bob's Guide to Prevent Surgery. Go to Amazon, check it out. I promise you, you'll be glad you did.